Perfect. Now you see it's arthrokinematics revision, right? So if I have to ask you for the hip joint, let me change the color of the font to white for better visuals. So if it's a hip joint, what do you think a hip joint arthrokinematics is? Is it convex on concave or concave on convex? It's convex on concave, convex on concave, convex on concave. So when you look at the slide on the right side, it says for flexion. Now flexion is anterior directed movement. For the anterior directed movement, if you're giving a glide in the opposite direction, which according to the slide is posterior glide, that means we're looking at hip joint as convex, moving on concave. So just to remind you again, when we say convex moving on concave, which means a joint is made of two articulating surfaces, and one is stable and one is moving, right? When the moving surface is convex and the stabilized surface is concave, like this, it's a ball and socket joint. That's what it's trying to say. Like hip joint, we follow the rule of convex moving on concave. So if it's an anterior directed movement, we'll be talking about opposite direction glide, opposite to the direction of the movement. For flexion, anterior directed movement, we give posterior glide. For extension, which is the posterior directed movement, we'll give the anterior glide, right? Okay, great. Now knee joint is a concave moving on convex, which means the tibia moves on the femur, right? And tibial condyles are concave and the femoral condyles are convex. If for flexion you give posterior glide, what would be the answer for the extension? For the extension, it'll be anterior glide. Very good. If I have to ask you a little bit further, on what surface? Glide on what surface? Which surface are you choosing? Are you choosing tibia on femur? Are you choosing femur on tibia? That is right. We are basically gliding the tibia over the femur. Very good. Patellofemoral joint. Patellofemoral joint. And if I have to ask you about knee flexion. Knee flexion. What do you think? For knee flexion, what glide would you give? Knee flexion. That is right. It's going to be inferior or distal glide. Very good. I'm so proud of you guys. And for knee extension, it's going to be superior or proximal glide. That's absolutely right. Great work, everyone. Okay, moving on very quickly to the ankle joint. And now ankle joint is convex moving on concave. So what glide do you want me to give to improve the dorsiflexion? Dorsiflexion. For dorsiflexion, I'll give posterior glide. Posterior glide on. Posterior glide on. Talus. Very good. Because it's talus which is moving on the tibia, right? And for plantar flexion, I'm definitely gonna go with the anterior glide on talus. Very good. Now, now listen to this very carefully. For eversion, you're giving medial glide. We're talking about subtalar joint, right? For eversion, you're giving medial glide. Are we talking about concave moving on convex or convex moving on concave? For eversion, we're giving medial glide. Eversion is the outer movement. Eversion is that the calcaneum is moving outside, right? But we're giving medial glide. That means for subtalar joint, we are following convex on Concave. I'm not doing multitasking today because my voice and my words are not aligning today. So you guys got to help me with this. Convex moving on concave. Very good. So when we speak of the subtalar joint, which bones are we looking at for subtalar joint? What two articulating surfaces makes a subtalar joint? Talus and calcaneum. So speaking of talus and calcaneum, which bone are we moving? Which bone are we sliding or gliding? That's definitely calcaneum, because when it comes to the eversion, it comes to the inversion, it comes to the calcaneum movement, the most distal movement. That is right. Okay, great. Very good. And that brings to the revision of the arthrokinematics, right? And these are your answers, what you did in the previous slide, basically. We removed the green boxes, and this is basically your answer slide. So if you want to print it out for your revision, that should work as well.